Yeah.
Hi.
Hi, Kevin. How's it going?
Pretty good.
You back, huh?
Yes,
I
I'm the
guess.
student nurse and I got you this time.
Again. So we have a patient here, writer kind. He has insulin problems and he's got a foot ulcer that's going on. He came here for the foot ulcer and we're trying to take care of that. And in the meantime, maintain his glucose at a good level. So we're gonna go in for insulin administration if you want to follow me.
Okay, I've got a couple questions for you
All right,
first.
let's do it.
Why specifically is this client receiving this medication and what action does the medication have on the body?
He's receiving insulin because his glucose has been a little higher than usual. So insulin is going to lower that to a safe level. And the action that insulin has on the body, it works almost like a key that it unlocks the glucose to get into the muscle and fat tissue, and it helps the insulin dependent diabetic to control their glucose better. For type 1, they don't make insulin at all, so then that will be his primary insulin. And for diabetics too, if they could become dependent, that insulin is going to help them maintain a safe level.
Okay. What was the action
It
on the
unlocks
body?
the keys for the insulin, for the glucose to get into the muscle and to the fat,
Okay.
and that's what it does. And it also helps potassium to get into the cell too. So
Okay. Which vital signs must be monitored?
we monitor all the vital signs at this facility. What we should be checking the blood pressure, heart rate, everything. But the main thing is checking his glucose. It's not a vital sign, but it's that's what we're checking mainly.
Okay. Um, which physiological parameters should be monitored when the medication is being administered?
Um, we have to monitor, for instance, if we administer this medication and his sugar goes below what a safe level is, he's gonna have certain symptoms, and we want to let him know that hypoglycemia will get him. He's gonna get a cold skin. He's gonna get sweaty, and he's gonna have a little bit of jitterness, and those are signs that if we give too much or if the insulin has too much effect on him, and we should monitor for those. Hyperglycemia too. The medication won't cause that, but we also have to let him know. He's gonna get warm and he's gonna get like an easy feeling, and so we'll let him know about all that.
Okay.
What else?
Um, what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
For us, we're going to be checking his sugar, making sure it's not at a low level, and then we give insulin and we lower it even more. We don't want that. We want it to be at follow the doctor's order, and here in this time we have a sliding scale, so whatever the glucose is, we're supposed to give so many units of insulin, and it just makes sure that he doesn't get any of the um, it's called hyperlipo what is it called? Hyperlipodystrophy, which is like it destroys the fat tissue where we inject, so we want to rotate the site. It's a bigger word, so it's kind of hard to pronounce. We'll just go with like rotating the site and making sure that we don't do it at the same spot every time and rotate it a little bit.
Okay.
Those are the main things at the hospital.
What interventions must be taught for taking the medication safely at home?
At home, we will teach him the same thing: monitor for signs of hypoglycemia, rotate the site, make sure he uses a new syringe every time, and do not share any syringes, and how to store the syringe. If it's he should use a syringe, and if he puts it in the refrigerator, if it's a mixed insulin, he can leave it up to 2 weeks in the refrigerator with the needle up. That keeps the insulin from crystallizing at the top of the needle, and it would hurt more when inserting. And so, how to store the syringes at home, and monitor for glucose before giving, and what to do with hypoglycemia, which would be giving carbohydrates. We'd get like 4 ounces of milk or 2 ounces of grape juice. So
Okay. What are the side effects and potential adverse reactions or effects?
the main side effects are the ones we already mentioned. It would be hypoglycemia, lowering it too much or giving extra dose, or his body uptakes it really fast. And the fat destruction on the site that we inject, so that's why we rotate. Those are the main big ones.
Okay.
Any other questions?
How will you know the medication is effective?
The medication is effective if we get his glucose level to a better level. So right now he's above what we want, so we want it to be in between 80 and 120, so we'll try to get him to that. And that is it. Make sure he doesn't have any signs of hypo or hyperglycemia, and maintain a safe level. And of course, he came in for the foot ulcer. We have to take care of that. We're not doing this right now. It's going to be done later today, but we just make sure that everything is good for him.
Okay.
All right.
That's all the questions I have till after.
All right. So I'm going to look on the Mars here, make sure his medication is at the right time and the right dose. Make sure you got the right patient, the right route. Make sure it's at the time we have to give. So let's see here. We have, the time right now is 17 hours. So we have regular insulin, recombinant insulin, regular insulin, Humulin R, Levodopa, which is on here. Let's see what we have here. Insulin, regular, recombinant, regular insulin, Humulin R, so it matches. We're going to draw the right dose. So what I'm going to do, I'm going to go into his vital signs and get the glucose level that he had. He had a 290. So we're going to go to the MON and we're going to find out how many units of insulin are we supposed to give if he has a glucose of 290, and it was 15 minutes ago. So let's see. Come on. Okay, it says for a glucose of 290, we're going to be giving 16 units of insulin. So the doctor said if you have a glucose of 241, in between 241 and 300, which is 290, we'll give 16 units of insulin. So that's what we're going to be giving right now. And I'm going to draw the insulin here. You doing okay so far?
Yep.
Alright, so clean the side too. So I have my insulin ready. I have the syringe ready. I'll clean the top here so I don't contaminate my syringe or the vial. Just clean it. Just need insulin is right. So I'm going to draw 16 units. And insert into the vial. Now I draw 16 minutes. Okay. It's here. I'll cap it like this so I don't risk of starting myself. And I think we're good to go. I have a wipe here for this insulin. I'll put it back here just for see if we can throw away. And we're ready to go in. You ready?
Yep.
Right. How are you doing?
Good.
I have your insulin for you. Is that okay if I come in?
Yes.
Okay. Let's go in. I have a student with me, Kevin.
Okay.
He's been here so many times already. He should be a nurse already.
Yeah, I'm
Yeah, I saw
Getting
him
around.
float around today.
Alright. So where do I
You look a lot like a nurse I was with earlier.
where do I put this? Okay. I think this is good here. Let me just put this in the truck. So how are you doing?
Good. I'm doing fine.
Good. We came here to give your insulin. I know you saw me before, yeah. I know you saw me before earlier today, so.
Okay. Yeah, I did. You're Renan, right?
Yes,
Yes.
I am.
I remember you.
Okay.
I never forget.
So, you feeling okay?
Yeah, I'm just weak. I think it's from everything, you know, that's been going on. But
Yeah.
I do feel better than I did.
You had a sugar of 190, 290?
Today it was 290.
Yeah, 15 minutes ago when the tech came in and checked.
Weeks.
Yeah, so your doctor has ordered that we give you 16 units of regular insulin.
Okay. All right. That sounds good.
So that insulin has a peak, has an onset of 30 minutes to an hour. So we just want to make
Okay.
sure that if you have any signs of hypoglycemia, it will be around that time. So I'll be coming
Okay.
back and checking on you and everything.
Yeah. Yeah. Usually I don't have too much trouble with that.
Yeah.
But
Okay.
yeah, I'll know to look for that.
Do you have any questions about side effects or what?
Well, I know I get sometimes. You know, I can get low blood sugar, but I know how to deal with that.
Yeah.
I mostly give in my stomach,
Yeah.
and I do tend to use the same spot.
Yeah, that's what I was going to talk about.
Okay.
Because if you inject it on the same spot all the time, it destroys the fat tissue and it kind of gives you like it
Yeah,
gets
I have like a
red
little
and
dent
it
right
gets-
here.
Yeah, it gets a
Mhm.
little. It messes up the fat tissue there. So you should, if you want to use the belly, if it's a site you like
I
and it
do.
works okay,
Yeah.
you can rotate the area. For instance, you can
Okay.
make like a grid.
All
And you can
right.
start here in the morning and move on towards the day and then
Okay.
move on to the next day.
Just space them out. Okay.
Staying away from the umbilicus and
Okay.
spreading it throughout the day. So you don't
All
do it in
right.
the same
So
spot
go
all the time.
here. Then what? Then go down here.
Yeah.
Okay.
Yeah.
Yeah. Nobody
That
ever
would
told
help.
me. Can you believe nobody's ever told me that all these years?
You do know that if you give you this medication, if you have signs of hypoglycemia, if you're going to get a little cold and you're going to get a little sweaty and your heart might feel faster.
Okay.
So just let us know if you have
yeah.
anything like that.
Definitely, I will. And then I'll just usually I take orange juice or something like that.
Yeah. If it goes low, we'll be here. We'll be monitoring.
Right,
We'll
right.
be checking. But if so, we'll give you some carbohydrate, either
Okay.
like 4 ounces of milk or something that you like. If it's grape juice, we'll do 2 ounces.
Perfect.
Okay. I'm gonna get ready here for. I already drew your insulin. It's a
Okay.
regular insulin. It's prescribed for 17. Okay, we're getting there.
I've been poked so many times since I've been in this hospital, but these are small needles, so it's good. I'll be good.
Yeah. All right. So, if you can please tell me your first and your last name. So,
Rider Kind. Easy Rider Kind.
Okay. What about your age?
I'm 67.
Okay. I got it here. Do you have any allergies?
No,
I don't think you
none
have.
that I'm
Doesn't show
aware
here,
of.
but-
Nothing's, no problems.
Okay. So we'll see you, please. This cable here is.
It's like Walmart. My
It
friends
is.
call me Walmart.
And so we did. What we're going to do is I made sure that the patient is right and the name and the birthday is right. The medication is right and it's the right time. We already drew it 16 units. It's the right dose. And I'm not gonna sign it until she has completed. We have completed the administration. So, all right. Are we ready?
Yeah.
When was it the last time you checked? Was it which site?
Let me think. I think that they just did it here. So
Okay.
let's start with
do it
this
there?
grid thingy that you were
Okay.
talking about.
All right.
Because I think that's a good idea.
All right. So, you said this side?
Yeah, that'll work.
Okay.
That way I'll know my right side.
Right here. And we want to clean this side just to make sure that it's clean and we're not going to, less risk for infection.
Okay.
And so, he's going to be a little poke.
Okay. No pain.
How was it?
No, it was
Okay.
awesome.
I will put this in the sharp school table. Out we go. Crush here. So, how did that go?
Good.
Okay.
Real good. You did your
All
have a
right.
good technique.
So we'll chart the time. We'll say the glucose was 290, and that's why we gave 16 units of regular insulin. And my initials. And okay, so they've been administered correctly. So we will be coming back here 15, 20 minutes, half an hour,
Okay.
depending. If you call us before, of course, we'll be here.
Okay.
But,
good. Yeah, I got my little call
yeah.
light. Okay, good.
So we'll be monitoring for signs of hypoglycemia, which you've been taking it for so many years, so it should be okay.
yeah,
never-
I kind of know when it's coming on
Yeah.
if it is.
So just please let us know. You know,
I
just-
will.
Yeah.
I'd really like to get my sugars down. I mean, I know if I should probably exercise more and stuff like that,
Yeah.
right? Yeah.
Do you think your diet is okay? Do you think it's...
Well,
You talk to a dietitian? You have a dietitian?
I have kind of been cheating. It's just so
Okay.
hard after all these years. But yeah, maybe it would be a good idea at some point.
Maybe I can have a dietitian stop by and
That would be
talk to you.
great.
Would that be okay?
Yeah, just so I can. I'm just motivated with this thing on my leg. I'm just motivated to try and keep it more
Yeah.
controlled. So
Yeah.
that would be
That would be good
That would
for
be
you.
great.
What about
Okay.
tomorrow? Will tomorrow be okay?
Yeah, I'm
Okay.
sure I'll still be here.
Okay.
Will
I'm
you be
sorry.
here?
I will be here.
Oh,
too,
good.
so
Okay.
We'll be here today, tomorrow, and the day after. So.
Oh, good.
Yeah.
Good.
So,
I like that. Okay.
Alrighty, so we'll walk out. Just let us know if you have any questions. And
I will.
we'll
I
be
should
here.
be fine, but I'll call you. I know how to get you if I need you.
Alrighty.
Thank you, Renan.
Thank you.
Thank you, Kevin.
Bye-bye.
Good luck in your school.
See you soon.
Have a good teacher.
And so, Kevin, how did it go?
Pretty good.
You like it?
Yeah.
It was cool. It was pretty easy.
It was
going, too.
awesome.
Yeah. You got to learn from it, did you?
Yes.
Okay, good.
I've got a couple questions
I
for
knew
you.
you would come up
Of
with
course.
questions, dude. It's always like
If
that.
there were pertinent pieces of information you reviewed before administering the client the medication, what were they?
We looked at the glucose, the main one, because you don't want to administer it if it's too low. If it's too low, you want to give some sugar. If it's too high, then you give glucose, and it was too high, higher than we wanted. That's what we looked at.
Okay. Did this information affect your decision to administer the medication? If yes, explain how.
No, we did not. It was the sugar was 290, and the doctor had prescribed 16 units of insulin for a sugar of 290. So we did that.
Okay.
Any other questions?
Yep, one last one. Did this information affect how you administered the medication? If yes, explain how.
No, it was the only thing, like she mentioned, she had administered earlier on the lower abdomen. We just moved up a little bit, and we did the teaching about the grid. So That was the only thing that we did change. We just changed the site from previous. That's it.
Okay, that's all the questions I
You
have.
good?
Yeah,
All right. Thank you.
you're welcome. Thank you. Bye bye.